Welcome to the show today. We had a lot of requests for a sleep expert. People are not getting enough sleep. We're on our devices. We are, trying to skip out on sleep to do work. There's all kinds of issues that we're seeing with sleep right now. And I think it's getting worse, is my take on it. We also see, like in psychiatry, psychology, that most of the conditions that I see with patients, there's an associated sleep issue. So either bad sleep causes that thing to happen, anxiety, depression, substance use, or that thing, anxiety, depression, substance use, PTSD, makes sleep a lot worse. So sleep is something that we often think about in mental health, and it impacts all of us, obviously. And there's just been a lot of talk about it. So I wanted to bring in an expert, someone who has studied this for years, has a medical degree, and is a sleep expert, and put on a bit of a masterclass for us today. So we got that today. Dr. Payman works in the sleep world, has done so for many years, does research in this world, and has some really practical advice on how we can improve our sleep. So it gets right down to the brass tacks of what we can do to improve our sleep. I hope you enjoy the show today. I'm Dr. Ryan Todd, a psychiatrist with over a decade of experience. And in this series with leading experts, we will explore the complexities of mental health, breakthrough therapies, and today's hottest topics. This is Beyond the Checkbox Mind Masters. Okay, if you don't mind, I want to start with some of your clinical work and chatting about, like, what is the most common thing that you see?
So in sleep labs, the most common sleep condition is chronic insomnia. Before COVID onset, the prevalence of chronic insomnia was about 12% in North America. And after the onset of COVID pandemic, and the prevalence increased to 20% or higher, and it hasn't got better by the recent data at all because of the ongoing stresses or global stress, or whatever being called, like social stressors and so on. So it's a very common condition.
Pre-COVID, chronic insomnia, which is when you can't sleep and it's not going away, it's been around for a while, was 12% of the population. Now it's pushing to 20% and higher. What's your take on that? That's a massive increase.
It is, and it shows how human health status would be sensitive to the environmental changes and social factors, which we always see in the realm of psychiatry, and insomnia is not an exception. Here we see a huge surge in the prevalence of chronic insomnia, and that could come with many potential consequences as well.
Okay, this is interesting. I think a lot of people think sleep is this very biological thing. I guess I think that to some extent. What you're saying is it is psychological. It's the stressors, the external, the negative news feeds, maybe a social media, like the world feeling chaotic. That is what's contributing to an increase in chronic insomnia.
So that is a factor because that's true. It's quite heavily genetic based, as the genes are autosomal dominant, and usually you could find one of the family members of people with chronic insomnia to having chronic insomnia as well. But at the same time, those play as predisposing factors. Precipitating factors could be social stressors or change in life, such as having exams at the university, or having a child, or become pregnant, and so on, and biological stress or social stress. But what is also important is how we could mitigate the perpetuating factors' impact on patients' health status, because these could act as triggers and they could trigger the condition. Predisposing factors makes the person susceptible for that, and precipitating factors could just trigger the onset. But people's maladaptive behaviors or changes in their lifestyle could perpetuate and could continue to this issue. And usually modifying those factors could help the person not only get better with insomnia, but also not being in need of taking a sleeping pill for a long term in many cases.
Do you think everyone's sleep has gotten worse? Like we look at the whole bell curve and you're seeing the top most at risk, rather 12 or 20%. Do you think that whole bell curve has shifted? Like everyone is getting worse sleep because of some of the factors you've listed?
So that's a good question, Ryan, because there are studies from 1960s in North America that people living in urban areas had 8 hours and 15 minutes of sleep in average. So when you look into the population, you're talking mostly about healthy people. And that decreased to 6 hours and 50 minutes right about 2010. And it has even shortened a bit further in the last 15 years. So it seems that lifestyle changes or more stress or having more things to do during the daytime or even traffic, the time that you need to commute to and from work, all of these would contribute a bit to having less time to rest. And also, part of it would be also factors such as light exposures or having um, availability of the cell phone and your laptop and TV at any time of your evening. They're not helping. And you need to know how to manage those to get better. And there are lots of things to be done in terms of communities and societies to advocate what could be done to do better.
That's so interesting because that's a real data over the course of many years, and it's similar set data, like you're looking at urban centers. So what do you tell people? So someone comes in with chronic insomnia. What do you do to help them get better? What are some of the steps you take?
So what we generally do, the patient goes with assessment first because we need to know what are the other coexistent conditions medically, psychiatry aspect, and also sleep disorders comorbidities. Because chronic insomnia is highly comorbid with other medical, mental, and sleep conditions. I give you example. One of the common ones is comorbidity with sleep apnea. So nowadays, in some province or in some states, people may not get full coverage for treatment of mild sleep apnea by their complementary insurance, but there are lots of papers in literature that even mild sleep apnea could lead to comorbid insomnia and sleep apnea, a condition called COMISA in abbreviation. So that could cause lots of impact without issues with decrease in or decline in oxygen saturation necessarily at night, but could be still impactful on patients' health. Or COBUSA, which is comorbid of insomnia and obesity as well. So there are other comorbid factors. Chronic pain is a condition. I should correct myself. COBUSA is comorbid of sleep apnea and obesity, but we have lots of chronic pain issues, lots of GI problems. Reflux could definitely be a factor, and also we have lots of mental health conditions. 90% of people with depression have some sleep symptoms, and 80 to 90% of patients with anxieties have sleep chronic insomnia, sleep issues, and also lots of sleep comorbidities such as restless legs, which increase the risk of chronic insomnia by 3-fold in people who have that condition. Parasomnia, such as sleepwalking or REM behavior, increase the risk of insomnia. So we need to know about those factors first. And after that, after addressing the coexistent conditions, if they need to be investigated for those, then overnight sleep test would be the gold standard to be done. Otherwise, patients don't need to do lab-based sleep test or any objective measurement to be obtained to be diagnosed. Chronic insomnia is a clinical diagnosis. And after that, people could be enrolled in cognitive behavior therapy as the gold standard And sometimes medications could be needed in conjunction as well.
So when you rule out some of the medical stuff and then also the genetic stuff, and somebody has insomnia and you look toward a mental health treatment of that, usually it's cognitive behavioral therapy. That's the modality that you use.
So cognitive behavior therapy is the gold standard for insomnia treatment, and mindfulness-based cognitive therapy has also emerged to have some evidence for helping people with chronic insomnia. Um, Generally speaking, cognitive behavior therapy comprises of a sleep hygiene review and behavioral techniques such as stimulus control, sleep restriction, and some other methods such as counter control technique, um, and also some cognitive techniques, how the person could shuffle the mind, how they could distract themselves, how they could have a balanced view toward their sleep, or how they could correct the magnifying way of thinking about their problems and so on, and also with practicing them, solidifying the behavior change to be able to improve the sleep quality and quantity.
Walk us through some of the behavioral changes that people can do to get better sleep. Like you said, sleep restriction. There's a couple of other things. Can you walk through those? I think those would be very helpful.
Sure. Yes. The most common one would be probably stimulus control. Is very easy to do. In a stimulus control, um, uh, people being told that bed is only for rest. You can't read in your bed, as the same as you can't get your laptop to the kitchen and eat the same time, because then you don't feel the taste of food, and then you may overeat or undereat, and you can't even remember the taste. The same with the sleep. Bed is only for rest. When you do this, you could recondition your brain to sleep better when you're in bed. So this is a good technique, and studies in the last 20 years showing that not single behavioral technique or cognitive technique modality would be strong enough to help, but usually there are combinations of modalities that could help. The other behavioral technique is sleep restriction for sleep. In a sleep restriction, people count their total time that they sleep at night by using sleep diary, or by using the data from their wearable devices. And if they're spending 8 hours in bed and they are getting 5 hours by any estimate, then they are trained to limit their time in bed to 5.5 hours. It's not recommended to decrease it to less than 5.5 hours because it's very necessary for cardiovascular rest and getting the minimum amount of rest to get ready for the next day, and also for the brain recovery. By limiting their time in bed, their body will experience increase in homeostatic force, which would help them within a week, more or less, to sleep deeper and with less disruptions. And as soon as the sleep efficiency, which is total time of sleep divided by total time in bed, improve from any number below 85% to 85 or higher, then they could increase their time in bed by 15 minutes per week to eventually find the sweet spot of how long they could stay in bed with least disruptions, and also maintain their sleep efficiency around 85% or 80% the minimum. Sleep restriction cannot be used for people who have another untreated sleep problem, such as untreated sleep apnea, even if it's mild, or untreated restless legs, or people with other morbidities, such as chronic pain, that they might need a bit longer time in bed to get their minimal recovery for the next day. But it usually applied with success, and it should be practiced cautions for patients who are working with heavy machineries, or they might be at risk for developing manic episode or hypomanic episodes, or people who might have epilepsy and seizures, as it could trigger those. But generally speaking, it could be practiced with the help of health professionals as an effective method to help. And there are some cognitive techniques that those such as mind shuffling could be used to distract the mind and prevent hyperfocusing on the sleep issues when the person is in bed and they cannot fall asleep or they cannot fall back asleep. So this is a nutshell of what being practiced in cognitive behavior therapy for insomnia.
What's mind shuffling? Tell us a little more about that.
So mind shuffling comes with a basic that people with insomnia tend to focus on their issue to solve it. And this is usually counterproductive because any attention to your problem with the sleep could potentially lead to intention to fix it. And any intention to fix it might lead to some efforts to fix that. And effort is counterproductive to sleep. By distracting your mind, not to pay attention to this issue, which could be done, for example, by choosing a word randomly. For example, if I wake up in the middle of the night by my kid or by other factors, which could be normal, then if I find that I might have a challenging time fall back asleep, I might use a random word or choose it. For example, it could be Orion. And then I come with finding 5 words starting with R. So it could be random, could be Randy, could be river. And then I go smoothly to the next letter with Y. And then usually this process is distracting the mind adequately. I have used it many times in the past if I found some challenge. And it works for 80-90% of the time so well. I don't need to go with selecting the second word. Just with the letters of the first word, I'm done.
Yeah, it's interesting because I think I do that too. Like if I wake up and I think of a problem, and I'll lay in bed for like an hour just going through different machinations of that problem. How do I solve it? What do I do? And I find I have to get up and write that thing down because I usually come to some sort of conclusion. And then if I write it down, it kind of gets it out of my brain and then I can go back to sleep or do like some sort of technique. But you're saying that's not good. Like what you're really trying to do is increase sleep efficiency. When your head hits the pillow, you want to be asleep. That's 100% sleep efficiency. If your head hits the pillow and you're starting to solve problems and your mind is racing, that is bad. That's decreasing your sleep efficiency. What I hear you saying is you have distraction techniques to get your mind out of that treadmill.
So Ryan, all are good techniques. There's no single recipe for people. Writing down, if there's anything specific in mind, would be good to write it on a sticky note or on a piece of paper. That would help not to have preoccupations with that and not worries about forgetting those. And also would be good to have a worry time in the evening, few hours before going to bed, and just allow yourself to worry about everything or anything needed. And then put few words on the paper to get back on them the next day or next week if needed. So all these are other components of what being done through therapy. But sometimes people worry for no reason, or even they don't have a good insight about the point that they're overthinking or overanalyzing, or even they might be hyper-focused on their just moment of not being able to sleep. So then mind shuffling is a tool in the toolbox, but those things you mentioned, those methods are good as well. So if the person knows about several techniques, then they feel more capable of managing the condition.
What do you tell people who are like high performing and they work a lot and they have kids and they are not getting a good sleep as a result of all those things? Do you tell them like, hey, you have because I feel like there used to be like 5 or 6 years ago, maybe there's a lot about like, don't worry about sleep, get work done. And now there's a movement to like, actually you need sleep to perform. Do you have advice for people who are restricting their sleep to work or study or get more done?
So that's a great point. It could be called as insufficient sleep syndrome. It's very common for adolescents because they need a bit longer time of sleep compared to adults, especially if they do school and hockey or some other sports and they have homework as well. And social media doesn't help either. And the same for adults. If at some point in their life, some stages such as having children or when they have exams or they work and study all the same time, or if they have projects to be accomplished, definitely insufficient sleep syndrome could be another coexistent condition to chronic insomnia, or could be present even as a single entity. As you mentioned, dedicating a bit more time to rest is the key or is the major key for managing this condition. And it could be done even by communications and to workplace or to school to accommodate what needed for the person by the health professional, as is a condition that could impact function, and it could be detrimental. It could be also a public safety issue because most people drive on the next day to work or school, and they may not be safe to drive if this is leading to chronic sleep deprivation. As we know that 1 hour of sleep loss in a week could be almost equivalent of 1 night of sleep loss. It's a serious condition, should be taken seriously, and the treatment is not necessarily medication, but by dedicating more time to rest and potentially communications with workplace or school to be able to understand the person's situation better and accept a plan to address it.
What do you tell shift workers? That's one thing I always have struggled with. People who are working night shifts, emerge docs, truck drivers, anyone who's doing construction overnight. It's so hard to give them good advice. What do you tell them? Because like in my experience, like 100% of them have a sleep issue. If not 100, it's very high. Firefighters, police. What kind of advice do you give them when they're trying to regulate sleep or just get enough sleep to get through the month?
That's a very important point. Many of them, as you mentioned, have or developing will develop sleep issues soon after starting or after a few years. In management of shift work, any coexistent sleep conditions should be addressed. Now, I saw a firefighter yesterday, for example, and it came as mild to moderate sleep apnea while he is quite trained and he is quite athletic in the body. So, for example, for such person, sleep apnea should be treated adequately by any modality that works effectively and is tolerated and is comfortable for the person. And also, there are treatments for shift workers which could be used before the shift or before they start their resting on an as needed basis or continual basis, which could help as wake promoting agents or medications that could help them get longer sleep after their night shifts with least chance of dependency. And also there are natural treatments such as light therapy devices, and also mitigating the bright blue light exposure for the last 4 hours of the shift is also a good and natural method to be used to help their body align with the circadian rhythm and with the geographical rhythm and time, in fact, for them.
I've heard more and more about light and how early light exposure during the day actually helps you sleep at night. Are you regulating light exposure and increasing it, decreasing it? Is that a big part of what you help people with?
Definitely, especially important for shift workers. It's very important for people with delayed sleep phase, which is very common in adolescence or early adulthood time, or even for treatment of advanced sleep phase, which is common after the age of 65. We had a lecture in Canadian Sleep Society, for example, in March 25, about a month ago, about the evidence of using light therapy around 5 p.m. and 6 p.m. for elderly population who were dealing with advanced sleep phase, for example. So light is the strongest light giver as a factor that could adjust our circadian and biological rhythm. And when sleep rhythm is adjusted as a clock in the body, many other parts of the body will work in a better way and better clock. For example, we know that our cardiovascular system works more efficiently at any time between 7 a.m. and 1 p.m. or 2 p.m. Our liver has the max level of activity around afternoon or evening, for example. So different parts of body goes with different clocks, but it's important to regulate the Greenwich clock to help the body work in a more synchronic way.
Well, it's a ton of information, and I think our listeners will really appreciate it. I did want to ask, what are you most excited about, and also I want your take on whether sleep is going to get worse or better. Can it get any worse? I don't know. It's gotten a lot worse over the last 30, 40 years. So what do you think?
So it's possible that with more advanced in technology and also with some changes, the sleep issues become more prevalent, insomnia, and with in fact more prevalence of obesity in the next 5 or 10 years. Sleep apnea would be probably a more common issue. So these are factors which could impact the sleep health, and subsequently many other medical and mental health issues. But at the same time, technology would help. For example, neuroimaging studies would help to get better understanding of impact of sleep on how the brain functions.
Awesome. Well, hey, I appreciate your time today, taking time out of your clinical and research schedule. I think we learned a lot. It's very practical. Like, we have some solid takeaways on what we can do if we're not getting enough sleep, but also learned a lot about what it looks like to have insomnia and try and help ourselves. So thank you for joining our podcast today. It was really good.